Okay. This meeting is being recorded.
All right, ladies and gentlemen, welcome, welcome, welcome. You have Dr. No Days Off here, and welcome to the Dr. No Days Off show. I have a very special show today because I have a very special guest, this young lady. We actually went on our doctoral journey together and everything, and I thought it was very interesting in what she did and what she does. So I just feel like that it's something that the world needs to know more about her. And ladies and gentlemen, I am talking about Dr. Tracy Taylor. And so those of you who are just now joining the Dr. No Days Off show, once again, you know who I am. I am a doctor of executive leadership. We talk about anything and everything on the Dr. No Days Off show. And today we're going to be talking about home health care, right? And how important it is to have this and why it's important for a family and important for you to know about it. So well, welcome, Dr. Tracy, to the show.
Thank you. Glad to be here.
You're more than welcome. Welcome to the doctor. I call it the Dr. NDO show for short. So you'll hear me abbreviate that sometime. And so we are live on Wisdom right now. And then we're also going to be recording this series to actually upload on my YouTube channel. And you can find me on social media. You can find me anywhere on social media. All you gotta do is put in Dr. No Days Off, and you will find me. All right. And I always say this: if you find anybody else, they're not the original, they're a copy. All right. And you know what happens when you get a copy of the original? You always downgrade. So you want to just go with the original. Right. I'm the original. Dr. No Days Off. All right. Well, welcome again, Dr. Tracy. We appreciate you coming on board. I know, I think we've been knowing each other for what, about, I don't know, couple years now, off and on. Well, in this world that we live in, we don't necessarily have to physically meet anymore because we know what each other look like. But we're not even in the same location. I'm in Virginia, and Dr. Tracy,
I'm in Decatur, Illinois. Decatur, Illinois.
Decatur, Illinois. Okay, is that where you're from?
No, I'm from Ripley, Tennessee, but I live in Decatur, Illinois.
Okay, yeah. My oldest daughter lives in Clarksville, Tennessee. She got out the military and decided to stay with her family there and everything. So that's good. So, well, let's get right into it, Dr. Tracy. Do me a favor. Can you give us a little background about yourself and tell us, the name of your company and what you actually do. Let's go ahead and start off right there. But give us a little background about yourself first.
Background about myself is I stay in Decatur, Illinois. I have 3 children. I have a grandson. I work in the healthcare field. I've been working in the healthcare field for many years. So I started off as a certified nurse aide working in a nursing home. So I decided that I wanted to, do another career, like about work in another environment. So I started volunteering at a local hospital. So I started volunteering at a hospital. Then after that, then they hired me as a certified nurse aide. So I decided that I wanted to, start, pursuing my career, advancing my education. So I went to Colorado Technical University. That's where I met you at.
Where we met.
So I got my MBA, right? So I got my MBA there. So my career started off good at the hospital. So I started working there, got promoted to a unit coordinator on the surgical unit at the hospital.
Okay. Right. Okay. Well, that's good. So do me a favor. What is, so people that might not know, I don't know technically what you say CNA?
Yes, I'm a certified nurse aide.
Certified nurse aide. What does certified nurse aides actually do?
A certified nurse aide take care of patients like in the hospital setting or nursing home. They could work in a clinical setting also. They care for the patient doing vital signs and medical terminology, doing temps. They do their temps, blood pressures, respirations.
Okay.
Mhm.
Okay, yeah, cool. Okay,
I also do my personal care too.
I've always heard CNA, and I've been around people in the medical field a little bit, so I kind of heard that term before, but I never really knew what it is to actually do. I know there's different levels of nurses,
Right.
and I know men can be nurses too, and it's not a degrade on
Right.
men to be nurses. Okay, it's actually nurses.
Right.
Nursing is actually a good field, right?
Right. It is. It's a lot going on, in the world with, COVID. So nurses, the healthcare field is actually, taking advantage of that, having a big career, doing, let's see what they're doing, traveling now.
Right.
So they
Now
can
I know
travel.
traveling nurses the traveling nurses make a lot of money because I've met a
Yes,
couple of
they
traveling
do.
nurses. Yeah,
Mhm.
that
Yeah,
that
so there's
that's
traveling
cool.
nurses, registered nurses, and also certified nurses aides are doing traveling nursing right now.
Really? So certified nursing aides can actually travel too?
Yes, they can travel too.
Wow.
Mhm.
I didn't know that. Now that I did not know. I did not know that at all. Okay. Well, I know what'd you say you got your MBA in? Well, you got an MBA in business administration,
Healthcare management. Yes,
healthcare
healthcare
management.
management.
Okay.
Yes, and I also got degree in leadership too, organizational leadership.
Is
I
that what
have
your
a master's.
doctoral in? Oh, no, your master's degree is in that.
Yes, my master's
Oh,
degree in that, and also my doctoral degree is healthcare management.
okay, that's what I thought. I was about to say, wait a minute, I thought your doctor was in healthcare
Right,
management. Okay, so you got two masters
right.
and a doctoral.
Yes,
Okay, well, you're better
yes.
than me. I
Mhm.
only did one master's and then one doctoral. I'm not doing anymore.
Right,
I'm done.
right,
Okay, I'm done.
right.
Um,
Mhm.
yeah. So that's good. So I want to know what. Well, I know why you pursued the degree. I'm assuming why you pursued the degree in healthcare management, but why go into the home healthcare field?
Going into the home health care field, it started during, COVID time, where a lot of families didn't want their loved ones inside, the nursing homes or, in, any other healthcare agencies, organizations, because, the spread of the virus was going around. So home care actually was a big step for everyone during the COVID time.
Okay.
So I decided when I got my doctor's degree, I decided after I pursued that, I wanted to go into home care, have my own home care agency, because that's something that I wanted to do.
Okay. I don't
Mhm.
recall. It's been a while, but what was your dissertation on? Do you remember?
Yes, my dissertation was on fall risk, actually in nursing homes, how to
That's
prevent
right.
that.
Yeah,
Right.
that's
Mhm.
right. That's right. I actually
Yes.
read your dissertation and I attended
Mhm.
your defense, and I thought it was
Right.
very interesting and everything that you were saying. That's why I wanted to have this interview with you because
Mhm.
because you talked about that. So I'm gonna go back and forth here a little bit, but well, I'm gonna circle back to that here. So what's the
Okay.
name of your company?
My company name is Devoted Caregivers,
Okay, and
and
you're
we're
located.
a non-medical. We're non-medical.
Okay, now what do you mean by non-medical?
Non-medical means we only do, like personal care. We also do transportation, errands, light housekeeping. And we take patients to their doctor's appointments. We also can take them shopping or, to any type of appointment that they have.
Okay,
So we
so
don't do anything medical. The only thing that we do kind of medical is we remind them to take their medication. We can't give them the medication
they have.
or do dressings. Uh-huh.
Right. Okay. That's part of what's in the insurance industry because I own my own insurance agency, and I deal
Mhm.
with long-term and short-term care. So that's part of what they call the ADLs, right?
Right. Mm-hmm.
Right. Okay, that's what I thought. It's called what was it called ADLs. And for those of y'all probably saying, well, what's the ADLs? I cannot remember the. I know.
I believe it's activity, daily living. I
That's it.
believe.
Yeah,
Yes.
that's it. That's it. I had to know that
Yeah.
I had to know that to get my
Right.
license and everything. And I still deal with it, but I always forget acronyms. I always do. I know about them. I know what they are, but the
Right.
acronym for it, I forget those. So yeah, so those of y'all that don't know, there are certain what we call ADLs in the insurance industry and in the home healthcare industry. And what Dr. Tracy is talking about is the ADLs is what they take care of. And what a lot of people don't know is that when you have insurance like long-term care and
Right.
short-term care, Dr. Tracy's agency is the ones that you can call when your loved one needs assistance with the ADLs, getting themselves dressed, like I said, taking them places and all this good stuff. They don't administer medications or give shots, things like that.
No.
But when it comes to long-term and short-term care, it involves a lot of what Dr. Tracy does here. It works hand in hand. And normally what a lot of people don't understand is, and Dr. Tracy, correct me if I'm wrong, a lot of people don't understand is when they have long-term care or short-term care, LTC or STC, that insurance company does not dictate who the home health care agency is going to be. You have to still go find, you're right. You have to go find your own agency or find an agency, and then your insurance will come in and say, okay, well, we'll pay them and all this other good stuff. But the insurance company does not contact the agency for you. And I've run into that problem before too. I've run into that issue before too. Okay, so
you come find us.
Go ahead. Go ahead. What'd you say?
You come find us. You come find us, and then when the client comes to us, we go to them and go to their house and do an assessment on them to find out what type of services they will need.
Okay, so explain a little bit more about your services. And my connection might be a little slow in our video, and that's okay. We'll take the time. But explain your services a little bit more in detail, if you don't mind.
Okay. Basically, our home services, we do personal care. Our personal care is like total care, assist with the client. And we also do transportation, like if they want to go to, say, for instance, they're shopping, or they want to go to the barber shop, hair shop. Let's see, some of my clients actually go, for appointments where they need to, go cash their check or something. We also do that. We also do light housekeeping. Yeah, and we also can go pick up their groceries and stuff too. They don't have to go shopping. We can also do that for them.
Okay. And so how do your clients will compensate you for it? Do you handle insurance, or do you?
Yes, we handle insurance. Yes, we handle long-term insurance. We also do checking, and we also do a credit card. So it just depends on what they want.
Okay. And is there a certain time frame, or y'all set up on a month, or you set up on like a 3 months?
We're set up like weekly. We set up like a weekly basis.
Okay. Okay. So that's even better because, and like I said, being in the industry, being in the insurance industry, and when you got short-term or long-term care, normally when a person, for those of you that don't know that's listening in right now, normally when you have long-term or short-term care insurance, short-term, it goes anywhere from 0 to, I think, 1 year. It goes to 0 to 1 year.
Right.
Long-term goes anything after 1 year. Okay. And normally that's when, a person has fell ill, or they have some kind of condition, or the case may be. and it's different from regular health insurance. That's another thing
Right.
that a lot of us don't know. And I'll be honest with you, it's nothing against anybody. Anybody that know Dr. No Days Off, you know how I am, you know, when I talk about this, but I do have a soft spot for, you know, for my African Americans, for Black people, because we just don't know, you know, and because of the years of captivity and the years of being held
Right.
privy to information, we can't say that now, but I'm just saying the years before it was passed down through generations. And even though the generation now has access to the same information that you and I are talking to, which is one of the reasons why we're doing this, they don't go after it because they're stuck in their old ways of thinking that it doesn't apply. And but we have a lot of issues with that, you know, and they don't understand that health insurance is one step. Long-term and short-term care is a whole nother step. You know, a lot of people, you know, and I deal a lot with Medicare, right? And it happens all the time. Because a lot of people, especially Black people and African Americans, however you want to see it, whatever, they feel that they think Medicare is going to cover everything. And I don't know, no, it doesn't. And then I said, and then Medicare will cover to a certain point short-term care. And by law, I can't really talk about a lot of stuff, but this is general information, so I can talk about this. But it covers a certain amount of short-term care, but after a certain amount of days, that's it. Care stops, right? And so, ladies and gentlemen, the reason why I have Dr. Tracy here is because that's when you need to know who to call, right? And Dr. Tracy is the person that has this agency that says, you know, that kicks in with your insurance. So I let people know, and this is one of the things that I have a major issue with Black people, is they think that their health care covers any long-term or short-term care. And I have to let them know, no, it doesn't. And they will argue me down. I'll be like, look, go back and read your policy. I'm not telling you this because I want to sell you something. I'm telling you it's looking out for you, right?
Right. And somebody, you know, explain it to you.
Right. Yeah. And so and then it never fails when they go back and they look at it, they're like, oh my gosh, yeah, I don't have long-term care in there. Well, I should have it. I say, no, it's something extra. That's extra insurance, right? So, and so, ladies and gentlemen, what I'm telling you is Dr. Tracy is the one that she started this agency because she knows there's people out here that are a lot of people out here that are like that, you know, and they think that the Medicare and the Social Security and all this and Medicaid is going to handle all that for them. That's not true, right? That's not true. So Dr. Tracy, tell me, I mean, do you get the same issue when it comes to African Americans? You know, the lack of knowledge in that area?
Yes, I do. I have family members where I have to go to do their assessments, and sometimes they don't, you know, want our services because they want, you know, take care of themselves, and you know, their, you know, loved ones tell them, you know, we have to, you know, go with this agency because, you know, they don't have long-term care insurance, but I let them know that it's out there, that they can get that, and I can, you know, give them the information to get that. Because our mission, you know, is to keep them out the nursing home or assisted living. We want them to stay at their home because they're more comfortable at home.
You know, I just lost one of my older sisters in June, and I lost contact with my sisters. My family dynamics is so screwed up. And last time I seen my older sister, I was a teenager, literally. You know, I'm 50 years old now, and she was way older than me. So I think she lived, she was maybe probably close to 7. I think she died in her 60s. And my niece reached out, got in touch with me and reached out to me to tell me. And when I talked to my niece, she was telling me how she went into a nursing home, and they're actually suing the nursing home right now. And not because of the money, but because of the treatment of my sister, you know, her mother. And she was telling me the horror stories. And you know, and when she was telling me, I felt inside, I felt, because this is one of my sisters that I actually liked.
Right.
She was always nice to me, you know. Like I said, my family dynamics is so, Dr. Tracy, you and I have really never talked about my family dynamics, but people that's actually listening to my podcast know about my family dynamics. It is so outrageous. But this is one of my sisters that I actually really like. She was always nice to me. You know, when everybody else wasn't, she was always nice to me, and I've always liked her. You know, but even though we didn't have a relationship because of distance and family and stuff like that, and my military service and all that. But when my niece was telling me what took place with her, you know, I felt bad. I'm like, and to be honest with you, one of the first people I thought about was like, dang. Now she was in Texas, but I was like, man, I wish I would have known somebody like Dr. Tracy, you know, because I know she has this home health care service. I'm like, dang, I could have hooked my niece up or my sister up with it because they treated her bad. You know, she ended up with bed sores and all this stuff. And this is one of my sisters. She's probably one of the nicest people you ever meet. She never had a mean bone in her body to anybody, even her own father who didn't do her right. Our father who didn't do her right either. She never had a mean bone in her body. And you know, and in her last days, she was badly mistreated. You know, and like my niece told me, she even came out and said, "Why?" You know, she was like telling God, "Why do I get treated like this? And I've never done anybody anything wrong." And that's what I can't stand that. You know, when it comes to
we get stories like this all the time. That's why, you know, families want their, you know, loved ones home, because they tried the nursing home or they tried assisted living and they're not getting the proper care what they need. So
and we're not saying all agencies are like this. We're not saying all of them are like this.
Right.
We're not saying that, but we know in America it's a big problem.
Right. It is. It's a problem.
Yeah, we know that in America, and that it's a big problem with these agencies, especially these, I ain't mentioning no names on here, but these big agencies, and they're not properly taking care of your loved ones. And then, so ladies and gentlemen, what you have is somebody like Dr. Tracy who dedicates her life to ensuring that your loved ones are taken care of, you know. And so, you know, this is a person that, like, I thought this was a very interesting topic. You know, y'all know I talk about leadership all the time on Dr. Node's, you know, on the Dr. NDO show, right? I talk about different aspects of leadership. I talk about different aspects of personal career development. But there's another side of Dr. NDO that a lot of people don't know. And like, I do have an insurance agency, right? So I know a lot about what Dr. Tracy is talking about, you know. And you know, I can actually, I have insurance. I can actually conduct insurance all over the country. So if I have clients that have that I get a LTC or STC client in Illinois and in Dr. Tracy area, I pick up the phone and I call Dr. Tracy and be like, hey, listen, you know, or I give them her contact information, like, listen, this is the person you need to call, you know, that provides certain services for you. So how big is your territory that you work, Dr. Tracy?
I do Central Illinois. We're out of Decatur, Illinois, so I do Central Illinois, and I also do Sangamon, which is Springfield, Illinois, and I do counties around.
Okay. And so you know, and so if you know anybody in the Illinois area, then you definitely want to get them you know, in touch with Dr. Tracy. And then before we end this interview, Dr. Tracy is going to give her information out. And you can give her a contact, and then definitely give your social media information out too. So you know, people can get in contact with you. But so yeah, you know, the home healthcare industry, you know, like I said, like we talked about, we know what's going on. You know, we know. I know Dr. Tracy. When did you launch your company?
We launched I launched in December of last year.
Right. Okay. So go ahead. So yeah, as y'all see, Dr. Tracy is new in launching her company. She's an entrepreneur in doing this. I have a lot of respect for her for doing this. And I'm gonna be honest with you. You know, I'm happy to see her doing this because, For, like I say, those of y'all that know Dr. No Days Off, you know me, I'm going to shoot it straight, all right? I have no biases against anyone, but I have a little soft spot because our people need to know, right? But, it's good to see, a Black woman, having her own business and running her business, because a lot of people believe, and even then today, a lot of people believe Black women can't do it. Or a lot of people believe that they got to be limited to hair or to service industry in some shape or form. You don't hear about a lot of them coming in doing what you're doing and coming into the insurance industry or part of the insurance industry, but you're kind of working with them a little bit, but you're coming into the health industry and saying, hey, even though you got these mega companies out here, you're saying, hey, here I am, and start my company, because I always let people know when it comes to entrepreneurship, when I talk to people on entrepreneurship, like, listen, these mega companies didn't start off being mega companies. They started off at one point, right?
Yes.
And they just kept going and kept building. And then there's other factors involved and things like that. But a business is like a child, right? It takes time for a business to grow. Yeah, you got your child.
You got to have a heart for it too.
Right. You got to have the heart for it. So I'm asking you, so why do you have the heart for this business?
I've been working in healthcare for about 30 something years. So I like to take care of people. I like to do customer service. And our mission is to make sure that every client that we have good quality care and service. And our mission also is to, make sure that they stay in the home, and we try to avoid anything for them to go into the nursing home or to assisted living, because we know our clients want to stay home. So that's also our mission too.
And so you talked about assessment. So let's talk about that a little bit. What do you mean by when you go in and you do an assessment for a family? Can you elaborate on that?
When I go in to do an assessment. The assessment that we do is like a service plan. So I go through, they tell me what type of services they need. So I also go by, if they have any problems like hearing, or if their mobility or feeding or anything. So I also go through that first, to make sure what type of services, that they would need.
Okay.
Because that's how we base their services on the service plan assessment.
Okay. Yeah, that's pretty good. It's almost similar to what I do in insurance.
Right.
I shock a lot of people, and the people that work with me in my agency. We shock a lot of people because insurance. Everybody hears the bad stuff about insurance on it. And there are some bad people. There's bad people in everything that you do. So, but when I walk into an insurance appointment for the first time, I don't walk in there. I don't walk in there to walk out expecting to sign them on a policy right then and there, because I really don't know what it is that they actually need. Right.
We give them information.
Yeah. I do the same thing. I give a lot of information out, and because I'm independent, so I actually built my relationships with my insurance companies. So I have several companies. So when I'm sitting down talking with my client, and then they tell me what they need, I got to go through. I go through different companies to see who has the best, who's the best fit. So I don't always sign a policy up, put them on a policy right then and there. That's not how we operate. So we do assessments too. So I understand that. That's pretty cool. I like that. And I like that too, because you're looking out for the patient, you're looking out for the family, because of the fact that they might think they need one thing and then they really don't need it. And what I found, is in some of these larger agencies, you have people to come in and even though they know the family don't need it, don't matter, because they have a package, and then they charge by the package. And so there's family out there wasting money. You see what I'm saying?
Right. Exactly. That's why we do the assessment, so they won't have to, go through all of that. Because if they need total care, then they will need, everything. So we go by the package also, but say for instance, if they need total care and they need housekeeping, light housekeeping and transportation, that's a price for that. If they just need transportation, then there's a price for that. And light housekeeping, there's a price for that. So they're not, being overcharged for something that they don't need.
Okay. And for those of y'all that just joined us on the Wisdom app, I have Dr. Tracy Taylor here. She is actually the owner of a home healthcare agency, and we're talking about home healthcare. We're talking about how to take care of your loved ones. If you know somebody that has loved ones, and everybody at one point in a stage in their life is gonna have to talk to Dr. Tracy, right?
Right.
At some point, unfortunately, in the world we live in the diseases that are out here, and the care that's out here, we don't want to think like that, but we have to think like that. I always let my clients know, and people that I talk to in insurance is like, look, I know you don't want to talk about death, but the best time to talk about death is when you're alive, not when you're dead. Okay, because I can't help you when you're dead. Right? I can help you when you're alive, but I can't help somebody
you when you're dead.
Exactly. So, so those of y'all that just joined us on the Wisdom app, we're talking to Dr. Tracy Taylor. And I tell you right now, if you have a question for her, you want to come on stage on the Wisdom app and ask her a question, that's fine. I'll just click the button to join as a guest, and I'll give you a couple minutes if you want to come on board and ask her any questions. I know, and sometimes people are shy; they don't like to ask questions. I don't know why, right? But they get shy sometimes on the Dr. Indio show and don't want to ask any questions and everything. But that's okay. But we're going to keep moving along and everything like that. So what I want to do is I want to circle back to what we talked about earlier. We talked about your dissertation defense and the title of your dissertation. And I was there. I actually heard, I thought it was really good. You did a great job. And then it was very informative, very informative on information about it. So to do me a favor, tell the audience again, what was your dissertation? Now, before she does that, for those of you who don't know, right, to get a doctoral, and the doctoral journey is a special one. Okay, it's a special journey. All right, it's not an easy journey. I'm not even gonna lie. I thought it was gonna be easier than what it was when I first got on board, and man, it kicked my butt. And I'm a very astute person, and it kicked my butt. But
we had a good teacher though too.
Oh yeah, we had an awesome Dr. B. Oh my gosh, Dr. B. I actually talked to her a couple weeks ago.
Okay, I need to reach out to her.
Yeah, I talked to her because Dr. Pam Brooks now did her dissertation defense.
Right. Okay.
I don't know if you remember her. Yeah,
yes,
Dr. Pam Brooks now. Yeah. So, but for those of you that don't know, to get your dissertation, you have to to get your doctoral, you have to perform a dissertation. And what a dissertation is your own research, right? And it is viable, credible research that you have to conduct. And then when you conduct this research, you put it together, you put everything together, and it's all there. Now you have to defend you have to defend your research. So basically, you have to go and talk about your research, right? And then and then of course you have to know what you're talking about, and it has to make sense, right? So Dr. Tracy, tell them what you give them the title of your dissertation.
My dissertation was the strategies of fall risk in nursing home organizations.
Yeah, she still remembers her. She still remembers her title. I don't remember exactly my title. I can give you. My title was long. Yeah. I use all the words that they allow us to use in our title, and I
kept it sweet.
So that's tell me why did you choose that subject?
I choose that subject because I was working in a hospital at the time, and fall risk is a major thing in nursing homes and also hospitals. And so we need to know the strategies of preventing, the patients or residents from falling. So I think that was a big thing for me to do because it's still out there.
Right.
And a
So,
lot of people, need to know how to, to prevent that.
right. So for y'all that don't know, Dr. Tracy's dissertation was published in Progress. It's an academic database, right? So you can actually go to Progress and order and buy her dissertation. You can do that.
Right.
And see what she talked about. And I was there for her defense. And I'm telling you, it's very knowledgeable information, stuff you need to know.
Right, it is.
Yeah, and it'll make you say, aha, right? Like, oh my gosh, I didn't know this. I didn't know that. So was there anything in particular when you did your research, was there anything in particular that stood out to you?
The thing that stood out to me mostly was interviewing, nurses and also CNAs, about strategies, trying to prevent fall risk because we're still, learning, new technical things that, that we could use for the patients, not to fall. For instance, if we have a patient that's in the bed and, they constantly, trying to get out of bed, that's their fall risk. They have devices, that will, make a sound, will tell them, not to get up, to wait for someone. And it goes, that signal goes also to the nurse's station, to let them know, somebody's trying to get up out the bed. And the alarm is so loud, everybody could, hear it. Even if the door is closed, we'll still get that, that signal from their room to the desk. And it also makes a loud noise, for any, a patient or a doctor or anybody, that will hear it. Yeah, so that's, one of the devices and stuff that we have also too for that. They also wear, special socks. They call red footies, where they have like a grip on the bottom of their socks, so they won't fall if they're walking inside the room. So there's a lot of type of devices and stuff out there, to prevent, patients from falling if they're, in a nursing home or hospital setting or at home or anywhere.
Right. And that's pretty interesting, and that's why, ladies and gentlemen, I'll let you know, that's what the Dr. NDO show does. We're here to give you information. And trust me, we don't charge you for it. Now, Dr. Tracy's going to charge you for her services. Right. So don't expect to call Dr. Tracy and get her services for free. All right. She's not a doctor for no reason. Okay.
Well, I give you good information.
But she is the expert, ladies and gentlemen. And now that's what you want to do. And I always let, people know, you want to talk to the expert. You don't want to, there's some areas of your life you could be cheap in. And then there's some areas of your life that you don't want to be cheap in. Okay. Because you get what you pay for, and
exactly.
So, you got to understand that sometimes, it's going to cost you to, good care always costs, so I always let people know. So I first want to tell you, on Dr. NDO show, they shouldn't do this. And if anybody does, you let me know, Dr. Tracy, we're going to straighten them out. But don't call Dr. Tracy up when she gives you her information. Don't call Dr. Tracy up and talk about, can I get the hookup? There ain't no hookup, right? No. It's straight services. Look, there's certain things that Dr. Tracy can and her company can do, and there's certain things that her company cannot do. And
exactly.
So, and
they work with you.
Yeah, but there's no hookups, people. Right.
Right. There's no hookups.
Yeah, you gotta be able to take care of your loved one stuff. That's something I get too.
Right.
In the insurance industry, I get that. Like, hey man, can I get a hookup? I'm like, hookup? What kind of hookup are you talking about? This is insurance, dude. What do you want me to do? First of all, I'm not going to jail for you. Okay. Right. I'm not going to jail for you. So that ain't gonna happen. So no, that ain't gonna happen. But So but that's interesting. That's interesting information, to know people to know that, there's fall risk. And if you have loved ones that are elderly, sick, can barely handle themselves and things like that, then this is information that you need to use, and Dr. Tracy is a person you need to contact. Even if Dr. Tracy is not in your area, I'm gonna still tell you, give her a call. You never know
Right. I could
what you
find
can.
somebody that's in your area.
Is that, see,
I could
right
find
there,
somebody in the area.
right there,
Mm-hmm.
right there alone. She can do that. See, it's all about networking too, ladies and gentlemen, which is one, believe it or not, I'm glad you mentioned that, Dr. Tracy, because that's one of the leadership, that's one of the leadership skills that I located within my unique executive leadership skill set for African Americans. Networking, building relationships was one of the key skills that I discovered. Well, I didn't discover it, but it's considered to be a crucial skill for African American entrepreneurs and professionals to succeed in. So, ladies and gentlemen, you got to learn how to network, right? You got to learn how, and networking don't mean what we just talked about. Networking don't mean always, that there's going to be a hookup at the end of that networking. Networking means is that you're getting with people that can get you the right information. Dr. Tracy, you said, well, I live in Texas. Dr. Tracy can't help me. No, Dr. Tracy just said, if you give her a call, she can probably get you on the phone with somebody in Texas in your area that's going to be credible for you, right? Instead of you just flailing in the wind, you have, what you do is you use your network to get there, right? So that's what, and I'm glad you said that. That's one of the things that I coach people on a lot is networking, is how to properly network with people. Right. Don't always look for a hookup. You never know what that relationship is going to develop. Right. Then, two, it's a relationship. You have to build on it. It's literally like expecting a ring on the first date. Excuse me? First date. I don't know you like that.
I connect with different nursing homes and assisted living. So I also connect with other home care agencies too. Right. So we all connect with each other and we do networking. And I'm also part of a Facebook group, home care agency Facebook group, where we get information. And there's a lot of people that's from Atlanta, Texas, all over, so if you need any help or need home care, if I can't help you, I can help you, put out that information to see if, someone can help you.
Yeah, and then she also networks with people like me, the big bad insurance agency that, if you're lacking LTC or STC or any kind of health or life insurance or whatever, she can call, because this is what I do. I network with people like Dr. Tracy and say, hey, Dr. Tracy, if I have a question, if I have a client that comes in, have a question or something, trust me, I'll pick up the phone and call Dr. Tracy in a minute. So Dr. Tracy, we have about 15 minutes or less left. So what I want you to do is I want you to go ahead and is there any last words or comments that you want to make to the people listening out there? And then at the same time, give them your contact information, whatever contact information you want them to have.
Okay. I just want to say to everybody, home care, it's a big thing now, out there, because, a lot of people, don't trust their loved ones, inside, facilities, and they want to keep their loved ones at home. So if you're looking for home care agency, my home care agency is in Decatur, Illinois. We're non-medical, we're local, and my information is www.devotedcaregivers.com, and that's www.devotedcaregivers.org. I'm sorry, not .com, it's .org. And I also have a Facebook that's called Devoted Caregivers.
Okay. So y'all got that information. Do you have a number that they can call?
Let's see. I have a 1-800 number, and let me see. They could call. Let's let's see here.
If you're anything like me, you can't remember all your contact information either.
Yeah, I don't remember. Yeah, I don't
Yeah.
remember my contact. I got it right here.
Yeah, people ask me all the time. They're like, what Dr. Williams, Dr. Indio, this and that. I'm like, man, listen, hold on. Let me look at my phone and call.
Yeah, because we don't give out our personal numbers. So this
Right.
the number right here goes straight to my cell phone, but it's 800-781-6237. Yep, and that's 800-781-6237.
You know what? And you know what? That's something too. And I'm glad you mentioned that. And I like that. And it's a new service. Those of y'all that are entrepreneurs, listen. Okay. Look, I'm not going to go off the subject here a little bit, but you know how Dr. Indio does. Okay. But because I'm passionate about what I believe in, what I believe when I talk about. I believe in this stuff, and it hurts me to the core when I'm sitting there and I'm talking to especially Black people, and I'm in the ignorance and the stupidity behind some of the stuff that is said, referencing home health care or the insurance agents industry. I just shake my head and be like, people, or even entrepreneurship. You know, I meet a lot, because entrepreneurship is one of my coachings. I meet a lot of I'll say beginning entrepreneurs, right? That they start off in their business, and so they have their business. They put their numbers, the information out there, and everything. And then if you go to call their number, it's their personal cell phone, and it's their personal cell phone because they like, yo, what's up? This is Keyshawn. I'll be like, that's not business, man.
Exactly.
It's understandable because you're like me. I have a business cell phone and I have a personal cell phone, right? So I do have two separate. So if I give people my number, 9 times out of 10, I'm giving them my business number first before I give them my personal number. You have to get to know me personally to get my personal number. And I tell people, don't give that number out to anybody. That number has very few people number. Mostly my family calls me on that number. But anyways, I have a 800 number connected, with my company and my insurance agents. We have an 800 number service that connects to their cell phone. They each have an extension. So when when one of their clients or somebody that the potential clients call them, they call the 800 number, put their extension in, it'll ring through to their cell phone. They have it set up on their cell phone to where when the agency number pops up, they automatically know it's from a client. Right? They automatically know that.
Right.
So they get to the, like if they got kids, because our agents and financial advisors work from home. So, hey, they tell the kids, shut up, put the barking dogs in the closet, and they answer the phone professionally, right? I always had especially Black entrepreneurs. Now listen, it's a business. You got to treat it like a business. So don't call Dr. Tracy. Right? And say, well, why she got an 800 number? Why she didn't give me her cell phone? She don't want you to have a cell phone. Right? No.
Right.
It's because, ladies and gentlemen, that's business. You call her 800 number, you're going to get somebody, right? And if you don't, and you leave a message, Dr. Tracy, they're going to call you back, right?
Right.
So. And I'm sorry, Dr. Indio had to say that because, you know how big people that been on Dr. Indio's show know, how I am about entrepreneurship. You know how I am about entrepreneurship. I love it. I've been involved in it for 16 years. I love it. I've been through the ups and the downs of it. I know the ins and rounds and everything. So, but this is one of the things that I help our people do is to say, listen, let me show you how to be a proper entrepreneur. I'm going to show you how to be an entrepreneur that can last generations and stuff like that. So, Dr. Tracy, is there any last words? Anything else that you want to say to the listeners out there? We have live listeners right now. We're going to have listeners that's going to come back and listen to the podcast later. Do you have any last words that you want to say to the listeners out there?
If you have any questions about home care or anything about fall risk or anything that's related to home care, you could give me a call, and I'm also on my Facebook page, Devoted Caregivers. You can leave me a message on there too. You can also leave me a message on the 800 number that I gave you also too.
Okay. And I'm gonna throw one out here for it too. Those of y'all that are listening live on the Wisdom app right now, and those of you that'll come back and going to listen later or watch on the YouTube channel later, I want you to go into LinkedIn and I want you to connect with Dr. Tracy Taylor on LinkedIn, right?
Yes, I also have Devoted Caregivers on LinkedIn too. I'm glad you mentioned that also.
Go in there and follow her company on LinkedIn. Go in there and connect with her on LinkedIn, right?
Mhm.
And that way, because when information is put out there, that's another way to connect with her and to network with her too. So with Dr. Tracy, I appreciate
Thank you.
you coming on board, spending some time. I know we've been trying to get this interview together for a while now. Dr. Indio is no days off, for real. Okay. I am working. I have goals, so I work.
I understand that.
And stuff. So, yeah, so we finally got it done. This is not going to be the last time.
No, that's not the last time.
Yeah, that we do this. I really want, and ladies and gentlemen, listen, I want y'all to help me out too, with Dr. Tracy and her company. I want y'all to put the word out there that, that she is there. Here's a Black woman that's going into entrepreneurship and that's looking out for people because this is what she's passionate about. Not because of money, she's passionate about it,
Right.
and everything. So get out there. So the next time that we bring Dr. Tracy back to the show, two things I'm gonna be looking for, Dr. Tracy. Two things. I'm gonna be looking for growth in your company, and I'm gonna be looking for growth. I'm gonna be looking for growth in the Dr. Indio show, right?
Okay.
So hopefully we'll be doing this on a whole different platform, and pretty soon, hopefully we'll be doing this on a television platform one day. You never know.
Yep.
You never know what's gonna take place, right?
Right.
I run the Dr. Indio show when Mrs. Dr. Indio is not with me, but when we're together, we run the Dynamic Duo show. People will see that and hear about that on Wisdom. But definitely, ladies and gentlemen, you can follow me on Wisdom. You can follow Dr. Indio on Wisdom. You can follow me on Facebook. You can follow me on Instagram. The only place you can't follow me on social media will probably be TikTok. Dr. Indio is just not on TikTok. Okay. I don't do TikTok videos, not yet, at least. I haven't warmed up to it yet, but you can find me on other social media channels. Ladies and gentlemen, we will have this interview uploaded for Dr. Tracy. Hopefully, my crew can get it uploaded today. We don't know yet, but it'll be uploaded here within the next 24 to 48 hours on my YouTube channel. You can just put in Dr. Indio or Dr. No Days Off, and you'll find me there. But ladies and gentlemen, I want to thank you for tuning in and listening to Dr. Tracy and myself. We appreciate
Thank you. I appreciate you.
I appreciate you too. Don't go anywhere yet, Dr. Tracy. But ladies and gentlemen, I want to just thank you. And once again, this is a Dr. Indio show, and I'm Dr. Indio, and I am out.